Hello and welcome back to T1D Academy. I'm Harold, and together with my son, we truly appreciate you spending some time with us today as we discuss another important topic around type 1 diabetes management and a video which builds on our previous video on understanding what basal insulin is. Today we're talking about basal rate testing. This is simply about confirming that the background insulin is appropriately set so that your blood sugars remain relatively level and flat during times of fasting, barring any variables that may impact blood sugars, as previously described. Basal testing answers one question. When you're not eating and not taking bolus insulin and there are no other factors in play such as puberty hormones, sickness, stress, or unusual activity, does your blood sugar stay relatively level and steady? We'll begin this topic by getting into how basal rates are set up initially. And then we'll transition into how to evaluate and adjust those settings appropriately over time. Most people do not start basal insulin randomly. There are established starting frameworks that healthcare teams use to estimate an initial basal setting. And then that estimate is refined through structured testing. One of the most common approaches is based on total daily dose, or what's known as TDD. That simply means the total amount of insulin used in a full day, both using basal insulin and bolus insulin combined. It's all the insulin your body needs for a 24-hour period. A common starting method is to assume that basal insulin should represent about 40 to 50% of that total daily insulin requirement. For pump users, that basal portion is then divided across 24 hours to create an hourly rate. For example, if someone uses 40 units total per day, about 20 units may be allocated as basal, as a starting spot. On a pump, that averages to roughly 0.8 units per hour as an initial estimate. It's not a permanent setting, it's a starting framework. It's also important to understand that it's not always a perfect 50-50 split. With pump users especially, you're using the same rapid-acting insulin for both basal needs and bolus needs. So the lines between those two percentages can blur a bit depending on lifestyle, insulin sensitivity, and daily patterns. Some people may run slightly more basal heavy, and others might be slightly more bolus heavy. The key isn't chasing a perfect ratio. It's making sure basal and bolus are working together to keep your time in range, or TIR, as high as safely possible, and minimizing lows. Another method, especially for someone who is newly diagnosed and just starting insulin, is weight-based. A typical starting range for total insulin needs in type 1 diabetes is about 0.4 to 0.6 units per kilogram per day, which is roughly equivalent to 0.18 to 0.27 units per pound per day. From that total estimate, roughly half is often assigned as basal insulin. Children, very active individuals, or those early in diagnosis may require less. Individuals experiencing higher insulin resistances, including during puberty, may require more. For those transitioning from multiple daily injections, or MDI, to an insulin pump, there is another important consideration. Because pumps use only rapid-acting insulin, healthcare teams often reduce the prior long-acting basal dose by about 20 to 30% when establishing the initial pump basal setting. This helps reduce the risk of hypoglycemia, which is low blood sugar, during the transition period. These formulas are not precision tools, they are starting points, often established by hospitals upon initial diagnosis via multiple daily injections, and then later converted over to pre-programmed basal rates within pump settings once a solid understanding of basal needs has been established through MDI management. They get you close, not perfect. That's where basal testing becomes essential. You estimate conservatively, then you observe, then you refine as necessary. Age matters. Younger children often have different overnight needs due to growth hormones. Puberty frequently increases insulin resistance and can require higher basal rates. Older adults often require lower overall basal amounts and sometimes use slightly more conservative fasting targets to reduce hypoglycemia risk. Basal is highly individualized. There is no perfect one setting for everyone. It is a personal setting that you work with your medical staff to understand and dial in correctly. There are also physiologic patterns such as the dawn phenomenon, where blood glucose naturally rises in the morning, often between the hours of 3 and 9 a.m. Pump users may program slightly higher basal rates during that window. MDI users may need timing adjustments under medical supervision to ensure that that peak is accounted for. And one critical principle, always start conservatively. It is safer to gradually increase basal than to start too aggressively and create unnecessary lows. Once you have a reasonable starting basal estimate in place, that's when structured testing becomes valuable. Basal rate testing is the process of checking whether your background insulin can hold blood sugar steady during periods without food or bolus insulin, assuming those other major variables like illness, growth, puberty, stress, or unusual activity are not interfering. Basal insulin is the steady drip. It's working quietly in the background 24 hours a day. It's what keeps glucose from rising between meals and while you sleep. When basal is set correctly, blood sugars stay relatively stable during fasting periods. Not steadily climbing, not steadily dropping, just holding fairly flat within a reasonable range. If basal rate is set too low, blood sugars will slowly rise even if you haven't eaten. If basal rates are set too high, blood sugars will gradually fall and can sometimes cause lows without any bolus insulin involved. Those steady upward or downward trends during fasting are what you're looking for where patterns are concerned for when you want to test and correct. Now, before we proceed, I want to be very clear about something. Basal testing should always be done with guidance from your healthcare team. This is educational information only. We're talking about structured fasting windows and increased monitoring. Safety should always be the first consideration, and any tweaks you make to your specific settings should always be discussed with your healthcare team prior to making them. Now, when you get advanced enough in your management, you may be able to remove the healthcare professionals from that equation when you become knowledgeable enough and you understand all of the different settings and what they mean and what they should look like. Then you can kind of begin taking ownership of your own management, which is where we've been for quite a few years now. But initially, when you're first diagnosed, you definitely want to work with your healthcare team to make sure that you're aligned on the kind of treatment adjustments that you plan. So there are two categories of people that we're talking about for this particular topic. People using insulin pumps and people using multiple daily injections or MDI. The goal is the same for both categories of people. Confirm that the background insulin is appropriately set. But how adjustments are made to achieve that goal are going to slightly vary. Let's start with pump users, because this is where the term basal rate testing is most commonly used. Pump therapy uses only rapid-acting insulin, as we've previously indicated. There is no long-acting insulin sitting in the background working during those fasting periods. Instead, the pump delivers tiny pulses of insulin every few minutes. Those pulses add up to your programmed basal rate. A common structured approach for pump users is sometimes called the 4-day plan. It's simply dividing your day into 4 quadrants or testing blocks so you can evaluate one quadrant at a time. Typically, that means testing overnight on one day, the morning block on another, the afternoon block on yet another, and then finally the evening block on the last one. You're isolating one window at a time so that you can see what your basal insulin is doing without interference from meals or corrections. The principle in all of these segments is consistent. During the testing window, no food, no bolus insulin, no physical activity, and no corrections that may interfere with the testing during that period. You want a clean segment of data without any extraneous variables being introduced. If glucose remains relatively flat, basal is likely appropriate. If it drifts more than 30 plus or minus milligrams per deciliter, consistently up or down across that window, that block may need review with your healthcare team and possibly needs adjustment. During a testing window, the goal is to observe and not to adjust. If your blood sugar becomes unsafely high or low, you should treat it immediately. But you must understand that any correction during that particular testing window completely invalidates the results of that test, and you'll need to redo the testing at another time. For those using multiple daily injections, basal testing follows the same concept, but with a different limitation. Long-acting insulin cannot be adjusted hour by hour like pump basal rates can. Instead, patterns are evaluated over multiple days and adjustments are made cautiously, usually in small increments under medical supervision. Basal needs are not static. Growth spurts, puberty, hormonal shifts, illness, stress, and changes in activity can alter insulin requirements. What worked well a few months ago may not work well today. Basal rate testing isn't a one-time event. It's a tool that you return to when patterns stop making sense. However, it's very important not to adjust your long-term basal rate settings based on short-term variables like a single stressful day, a poor night of sleep, or one illness episode. Basal insulin sets the baseline for your entire day. Bolus insulin works on top of that baseline to manage meals and corrections. If the baseline is not set correctly, meal dosing and correction dosing will feel unpredictable, and it will cause roller coastering effects. When basal is set correctly, everything else becomes easier to manage and more consistent. In the next video, we're going to talk about bolus insulin and how it works alongside basal to create a complete insulin plan. We will talk about what bolus insulin is, and then we will talk about how to establish an initial basal rate as well as how to adjust it over time. Before wrapping up, and as a disclaimer, this content is always for educational purposes only and should not be taken as medical advice. Always work closely with your healthcare team before making any changes to your insulin dosing, pump settings, or injection schedules. Until next video, take care of yourselves and take care of each other, and remember, you've got this. And as always, Liam, 143AI+1. Take care.